Good morning, and thank you for joining us today. My name is Tricia Van Denneker, and I'm the president of the Canadian Society for Medical Laboratory Science, or the CSMLS. With me here today is Christine Nielsen, the CSMLS Executive Director. CSMLS is the national certifying body and professional association for medical laboratory technologists and medical laboratory assistants. Medical laboratory technologists conduct complex laboratory tests on blood, body fluids, and body tissue. They also interpret test results and give these results to physicians. These tests provide critical information about your health. Medical laboratory professionals play an extremely vital role in Canada's healthcare system. As a group, our profession is the fourth largest healthcare profession in Canada, which is incredible considering we know that relatively few Canadians know who medical laboratory professionals are and, more importantly, what we do. This week, we are proud to be celebrating National Medical Laboratory Week. Since 1985, CSMLS has sponsored this week to promote awareness and understanding of the critical role of medical laboratory professionals in the healthcare system. This year's theme is Our Focus is You, and reflects the vital care that patients receive from medical laboratory professionals. We focus on patients' results so patients can focus on what's important to them. Canada's healthcare system is not solely comprised of doctors and nurses. Medical laboratory professionals generate over 440 million test results each year. Doctors depend on these laboratory test results to accurately diagnose and treat illness and monitor patient health. We have 18 medical laboratory professionals on Parliament Hill today to highlight the important role medical laboratory professionals play in the lives of Canadians and to urge government support for critical issues affecting the profession. Our first area of concern is the lack of financial support for the recruitment of new medical laboratory technologist graduates to rural areas. To ensure that all Canadians have access to quality health care, it is imperative to include medical laboratory technology graduates in existing and new incentive programs aimed at recruiting and retaining healthcare professionals in our rural communities. Without incentives, rural areas will be the first to experience shortages of qualified healthcare professionals, who are already the most difficult recruitment areas. We recommend that the federal government expand on their recent commitment of loan forgiveness for new family physicians, nurses, and nurse practitioners, as outlined in the 2012 federal budget, and include medical laboratory technologists in order to ensure that Canada's healthcare system is not compromised.
Secondly, Canada is presently facing a nationwide shortage of medical laboratory technologists. The current supply of new graduates will not be sufficient to address the projected shortages. Our organization predicts that, alarmingly, nearly half of Canada's medical laboratory technologists will be eligible to retire in the next 10 years. This shortage will undoubtedly directly affect patient safety within our laboratories. To help address the shortage, we are calling on the federal government to invest in a national health human resources strategy for the medical laboratory profession. This strategy would incorporate three distinct elements. First, dedicated investments targeted at clinical education, which is vital to the training of the next generation of professionals. As with most health professions, clinical training is a vital component of medical laboratory science education, and students cannot graduate from their programs without completing a clinical placement. Secondly, dedicated investments in the integration of internationally educated medical laboratory technologists. Internationally educated MLTs who complete a bridging program are more successful on the certification exams. Sustainable funding for these programs will facilitate a faster entry into the Canadian workplace. This is good for the individual, good for the profession, and good for the health of Canadians. And lastly, investment in quality of work-life initiatives. We believe the best way to recruit and retain healthcare professionals is to create healthy, supportive workplaces. Encouraging wellness programs and policies in the laboratory would reduce absenteeism and increase productivity. Continued education for medical laboratory professionals can assist in maintaining a high level of standard and protect patient safety. We recognize recent measures implemented by the federal government in addressing the need for medical laboratory professionals, such as the recent launch of the Foreign Credential Recognition Program Loans Pilot and the commitment of funding to research. We hope to continue building on this momentum as we move forward. Patient safety is our absolute number one priority, and we are committed to providing standards that ensure high-quality medical laboratory professionals for all Canadians. Our announcement today signals the need for the Government of Canada to take a more proactive role in developing a strategy for the medical laboratory profession. Together, we can ensure that Canada's healthcare system is not compromised and patient safety remains the number one priority. Thank you for your time, and we would be happy to answer any questions that you may have. Yes.
Thank you for your presentation. It was very interesting. I was wondering if you could elaborate a bit about, you said earlier you had 18 professionals on the Hill.
Yes.
And you would be meeting with different MPs. Are those spread across parties?
Absolutely. So our medical professionals are from coast to coast to coast in Canada. They're members of our board of directors as well as our provincial societies and members of the Canadian Society for Medical Laboratory Science. And they range in experience from newer graduates within the last 10 years to a couple of people who have actually retired. So we've also spanned the continuum of the profession as well. And we're meeting with members of Parliament from across Canada as well. From all parties, absolutely. We're also in both languages.
Is provincial discrepancy a big problem for your association? You're talking about the need to create a national strategy. Is that cause of concern? Regulation or
regulation of medical laboratory professionals is a key initiative of the Canadian Society for Medical Lab Science. We're regulated in all jurisdictions but 4. Newfoundland is pending right now, but British Columbia remains the largest jurisdiction right now without regulation, and it has been seeking regulation for at least 30 years, and the government has yet to realize it in British Columbia, and the public believes they're being protected. Without regulation, though, there is no regulatory body for the public to go to. So British Columbia is a place that CSMLS will heavily support regulation, as we did with Newfoundland following the Cameron Commission.
And are you hoping that the creation of federal initiative would change?
It's really more of a provincial issue, but the federal government was obviously privy to information coming out of several of the commissions that have been launched, and regulation is seen as a key to protect patient safety.
And we would support regulation of not only medical laboratory technologists, but we would support regulation of not only medical laboratory technologists, but medical laboratory assistants as well.
And to date, there's no jurisdiction in Canada that regulates lab assistants, who for the most part do the pre-analytical work for specimens. And it's really important in the continuum of a specimen that it has integrity from the moment it's collected till the specimen results are released to the family physician or healthcare practitioner. Thank you.